How does a screening for anxiety disorder work? It's not mandatory, but physicians all over the country are expected to begin prioritizing anxiety screenings in response to the panel's advice. So if you make an appointment for a checkup, your doctor will probably be ready to do the initial screening. This will usually take the form of a questionnaire that your physician will use to pick up on signs you may have an anxiety disorder. From there, you may be referred to a mental health specialist to complete the diagnosis, or be told that you don't show symptoms of the disorder. If you are ultimately found to have an anxiety disorder, things get a little murky. The standard treatment is therapy and/or medication, which have been shown to be effective for most people after only a few months, but whether you'll have access to the level of treatment you need is anything but guaranteed. As Dr. Jeffrey Staub, a psychiatrist and chair of the Department of Psychiatry and Psychology at Mayo Clinic, not a member of the task force, points out to the New York Times, the U.S. is short on mental health professionals at all levels, and a screening program won't be very useful if it doesn't lead to treatment for the people who need it. That's not the only potential pitfall. When providers say, "You must have a disorder. Here, take this," we could face an overprescribing problem. Staub says. But the opposite scenario is that we have lots of people suffering who shouldn't be. Both outcomes are possible. Why an anxiety screening can help fight systemic racism, according to task force member Lori Ilbert, a clinical psychologist and professor at the University of Massachusetts Chan Medical School. Another potential benefit of mass screenings for anxiety disorders is combating racism, implicit bias, and other systemic health care quality issues. Screening everyone rather than simply those who look like they might fit the typical image of an anxiety patient could ultimately lead to more equitable distribution of mental health resources. To a degree, anyway. Distribution of treatment and resources is still likely to favor those likely to actually have a primary care physician they visit on the regular. What about people over 65? The task force did not recommend anxiety screenings for people over the age of 65 because anxiety symptoms are similar to normal signs of aging, such as fatigue and generalized pain. This suggests to me that we should develop better testing for anxiety so we can ensure older people aren't needlessly suffering from it. But I'm no medical researcher.